Dr. Jessie Duppler here for Chain Reaction Physical Therapy, and today we're going to go over sciatic nerve glides. Your sciatic nerve is a nerve that runs all the way from your low back and actually connects all the way down to your foot. A lot of times when people come in saying they have pain anywhere from their back down their leg, oftentimes they'll see it in their butt, behind their knee. They'll say it's burning, shooting, stabbing, something like that. Oftentimes that can be from your sciatic nerve somewhere being inflamed. All of our nerves run through our body, through muscle, through different spaces, and they can get caught up anywhere along the way. Nerves, unlike some muscles, don't like to be stretched. When we stretch a nerve, what happens is we create too much tension on it. We can cause irritation on it over and over and over again. So when we're moving and doing things like bending over or twisting, what we can do sometimes is put too much stress on that nerve. So the aim of a sciatic nerve glide is to help that nerve start to glide through the body like it's supposed to better. So what you're going to do, so we're going to come into this position right here. We're going to work on the left side. I'm going to keep my right leg bent up to keep some pressure off my low back. From here, leg is going to come up just a little bit. If you feel like you have to strain to get to this position, you can use a towel or something to bring yourself back into this position because we want to keep any strain off low back and off butt, leg, foot, anything like that. So from here, what's going to happen is you're going to point your toes up towards the sky and then bring your leg up. Now, I'm only going to go as far as I can go until I start to feel a little bit of resistance, then we're going to back it off. Right now, people think this is a really good hamstring stretch. What this also does is also tensions the sciatic nerve. So if you're feeling a stretch through here with this leg flexed like, or your foot flexed like this, you're stretching your sciatic nerve. You're not just stretching out that hamstring. So we want to make sure what we're doing is keeping the stretch out of the nerve. So we're going to bring toes up, then toes point down, foot comes down. You should not feel any tension or any reproduction of your symptoms through this entire movement. If so, we need to back it off just a little bit and decrease the range. It should almost feel like you're just moving your leg in space. You shouldn't feel any stretch through here, any stretch here. All we're doing is we're teaching that nerve how to glide back and forth so that we can decrease some of the symptoms we're feeling. If we push too far into that resistance, into that stretch, again, we're irritating the nerve, we're not helping it. So we're going to just back and forth and then slowly come back up. As always, if you have any questions, check out chainreactionpt.com.